Hi, I'm Aggie, the skin therapist and founder of SILESIANA, the Advanced Skin Analysis Clinic. Today, I would like to talk to you about pigmentation. Over the past years, pigmentation has become a bigger problem, and not just due to genetics, but also due to depleting a protective ozone layer. So today, we will be talking how the pigment forms, different skin tones, how to prevent pigmentation, and in-clinic treatments. When we talk pigmentation, we have to mention melanogenesis. Melanogenesis is the process of production of color melanin. As you know, there are two main layers of skin. So there is outer epidermis and there is lower dermis. Dermis is very exciting with all the proteins that we keep hearing about, the collagen, the elastin, also the hyaluronic acid that floats in between them. But the epidermis is also very important. It's home to our cells melanocytes. In the very lower layer of epidermis, there is a layer called basal, and every 10 cells in that basal layer will be our melanocyte. It actually looks like our hand. The palm of the hand will be the body of melanocyte, and the fingers will be the melanocyte's arms, through which it will be sort of like shooting the color out to the neighboring keratinocytes. Keratinocytes are the layers, as you know, the layers of the skin that keep moving upwards to the surface of the skin and gets exfoliated about every 28 days. So you might ask me a question: if keratinocytes get all the way to the surface and then they get shed off, how the pigment still stays on our skin? Well, the color melanin, it has the power to communicate with the cell melanocyte once going up to the surface. So as it's going up to the surface and obviously closer to the UV radiation, it becomes darker, but also if the skin is unprotected enough, it has the power to communicate to the cell melanocyte to send more pigment, therefore producing more color and therefore forming a pigment on the skin. Also, when we talk pigmentation, we have to make sure that we know what is our skin tone. Therefore, there is a chart called Fitzpatrick's skin tone. Fitzpatrick's skin tone chart will categorize our skin from 1, the lightest color, the lighter skin tone, to 6, the darker skin tone. Therefore, it will be easier to find the right treatment for the pigmentation once the pigment appears on the skin, and also it will tell us the safe time for us to spend under the UV radiation. Once we know how the pigment forms on our skin, it's good to know that there are also substances or chemical substances, drugs, that can influence pigmentation on our skin. Pigmentation is always connected with the UV radiation, especially when we are on medication, prescribed medication, drugs, steroids, anti-inflammatory medication, blood thinner, or even a painkiller. They might have connection with the pigmentation appearing on our skin. Also, some household use chemicals like the wipes with the lemon oil that we use and can be easily transferred from our skin on the hands to our neck or the skin on our face. And then if we live into a daylight, the pigmentation might happen on our skin. It is good to remember that melanin is part of our defense system. So if we do stay prolonged hours under the UV radiation, the UV light will cause damage, especially when we go and travel in the mountains where it can bounce off the snow, or we going to the seaside, it can bounce off water and sand and cause even more damage. It's good to know to use SPF protection in the winter and in the summer. In the winter, there is less of the UVB radiation, which is usually stopped by the clouds. But we do have to remember there is still UVA radiation, which is responsible for aging of our skin. Once pigmentation happens, there are treatments that might help and brighten the skin. We have to remember that there are two types of pigmentation. They might be epidermal pigmentation, which is closer to the surface, and there is dermal pigmentation, which is always harder to deal with. When we treat pigmentation, we have to remember categorize the skin tone. Therefore, to choose the correct treatments. There are skin tones like Caucasian skin, which is a lighter color skin, and also ethnic skins, which are a little bit darker in color. If we use Caucasian products to use ethnic skin, we might cause more damage than we already have. So it is super important to find out what is your skin tone before any treatment of pigmentation. Thank you.